our alma mater, Oakwood University, is planning a graduation beginning of August at the Von Braun. 2,500 people, only 2,500 people, so they can be socially distanced out in Von Braun. Not sure if all of the services are going to take place, all three services are going to take place there or not. But that's the plan. 5 days later, they're expecting to open up the campus in a full-blown situation. So that's concerning. That's concerning to me because like you said, we're not where we used to be, right? The very notion of higher education is socialization. You go to school to kiss and to hug, and in some cases even have sex, right? You go to school so that you can play and run and jump and have study groups and interact with each other. That's the whole point. That's what school is for, right? And you sit in classes, ventilation systems notwithstanding, most of them don't have open windows anymore, and you're breathing the same air long periods of time, not to mention the dorm circumstances and situations with shared facilities, shared room space, and I can go on and on and on and on and on. So we keep it at 100.
I'm gonna keep it 100.
What do you say? You know you've got you had two kids graduate from Oakwood. I just had one graduate from Oakwood, and I'm still concerned. It's our alma mater. It's our school. What is your advice and what is your suggestion to the president, the administration, the board of trustees to our alma mater today? Let's go on record.
Well, I'm gonna go on the record because I'm gonna present this for the first time on your show. I'm gonna just be real.
Yeah.
Graduation with 2,500 people will infect other people. No question about it. We had a drive-by graduation service at my house for my son from high school, where over 100 cars came by, and the kids decided to park their cars. They got out with their mask on. They took their mask off. They touched, they hugged. What do you think is going to go on at the graduation? One, a graduation that size, they will be infected. They will have infections because of it. Number two, opening the school. I'm not just talking about Oakwood. I'm talking about all universities. What happens? How are you going to feed these kids when you have virus that will be active there? Kids coming from the United States, bringing various types of maybe New York kids bring one type, and the kids from the West Coast, they're going to bring another type. And you're going to bring them into a incubator, a petri dish, a reservoir where they're going to not wear. Are you expecting the college students to wear masks and gloves and social distance? I'm just trying to make it real. Are we saying that college kids are going to wear their masks? They're going to social distance, and they're going to practice safe interactions. If you believe that, I got some real estate in Arizona that I want to sell you. That's beachfront property.
Exactly. Kenny Anderson said,
"There's no way we can open our schools with a virus. I don't care what you put down on paper. They're not going to conform to those rules." And so put that aside, Dr. Thomas. Put that aside. I'm gonna ask you a better question. What do you do with them when they get sick?
Call mama and daddy. You call mama and daddy.
Are you gonna have a girls' dorm floor? Well, they can't go home, they're sick.
But I tell you, that's what they gonna do.
They can't go home.
They gonna call mama and daddy. That's what they gonna do. Say, go come get your kid. We encourage them to come, but now they sick. They go, you come get them. That's what they gonna tell them.
Now, not only are they gonna open up, but 3 to 4 weeks down from the opening, they're gonna do like all the other institutions that have opened up back. I want us to think clearly about this. I have a son that's a junior now at Oakwood. He's not going back until we have something that either is a vaccine or therapy that's going to protect them from going into that environment. There's no CDC rule. There's no guidelines that will protect your kids from getting this virus in that situation. I don't care what you do. You can put plexiglass between the 2 beds where you can put 1 kid in 1 room. We don't know that this virus, and we do know this virus is airborne now that we knew it months ago, but the the World Health Organization just admitted. We do know it's airborne. So do you have individual air handling systems for those rooms? It's going to be an infection. There's going to be infection. And the question, Dr. Thomas, is that 5% of the infections will lead to death. I don't want to tolerate any death from this virus when I don't have to. And I'm sure not going to send my beloved son into a situation where they will definitely get infected. There's just like no gray ground here. It's not fuzzy. If you go into those environments, you have no way to protect yourself from getting infected. And it only takes one person to go out and get infected and come back into the community and bring that virus with them. It's going to catch on like fire.
Before we go into the African American science relative to our susceptibility, let's just answer the question: can an individual be reinfected?
The answer to the question is 100% yes. And there's reasons why. Let me give you a couple scientific reasons why. One, you may not have developed the immunity that COVID-19 is. It's a different kind of virus. It doesn't allow certain individuals don't have the memory cells that will produce the antibodies that will keep them from being protected from that infection again. So if you don't mount the proper immunity, your titers are not high enough, you can be infected again. Second, the spike protein that I talked about is the key for a lock. But that key, usually with a key for your front door, you got one key, but you can make copies of it, but it's still the same key, right? It's the same key. It's just a copy. The spike protein is a key for the lock to the cell, but it has 5 or 6 different keys. So you make a vaccine for one key, it can morph into the other key and open the lock too. So that's the second reason. And then the third reason is because we now know we got multiple mutants. So one mutant may have affected you, but we don't know that you have cross immunity to the other mutant. So it's just like the flu. It's kind of a, well, 50% you're going to get the right vaccine and 50% that you will get the wrong one. And so we guess as to which one to give you, and we put it in and give you it as a vaccine. It's the same thing for this one. And then the fourth thing, we've been trying to make coronavirus vaccine since 2003. We still haven't done it. Why are we going to make it now? 17 years of working on this, and all of a sudden we all of a sudden gonna discover it now? We need to stop playing with the American people. It's a ways to offer us hope without playing with us. The issue, we're not gonna to be you can, the answer is yes, you can be reinfected. It may not be with the virus that you first got. If you have proper immunity, you definitely can't get it then. But you could get it if there's another mutant. You could get it if you didn't mount higher titers. The answer is yes, 100%. I want to say that the children, we've been told, I got to stay on this point because we're going to be parents are going to be facing decisions in a couple of weeks of what to do with their kids. And their decision making has to be clear because this is a life or death decision. Your child may be one of the 5 out of 100 that dies from this virus. And I want to give some data, and here's some more data. I want you to get, because that's what we do on this show. We bring the data. There was a report from the Austin Public Health. It's children between the ages of 1 and 9 have tested positive is about 9% for their community. Now watch this. The same data records among patients 80 and older is only 2%. So they told us our children are less susceptible. Our children are not susceptible to this novel virus. It's not actually the data, because we haven't really seen this virus, and we've been peekabooing it with, closing, shutting down, opening up, shutting down. We don't really have the full view, but they're now saying, based on the data that they have, children between the ages of 1 and 9 are about 5 times more likely to be positive for this virus.
Wow. Amazing.
So I just want us to be clear that children can definitely be infected. We don't know yet, and we don't have enough data yet to understand how this will infect children down. I'm not even going to Kawasaki's disease and all the other types of diseases. I'm just focused on infections and mortality and morbidity. We don't know that young people who get this virus will have lung fibrosis the rest of their life. We don't know what the infection will cause down the road because we haven't gotten down the road far enough. But I will tell you, you don't want to be infected because we don't really know the outcome. We do know that 5% will die. Mm-hmm. That's enough for me.
Yeah.
And I just wanted to be clear on that. I saw some things coming across, and I just wanted to be clear about children. We stated that back in March that children were less susceptible. Children didn't get this virus. Now the average age has gone from 65 down to 37, and I will guarantee you, if we do the same analysis in a week or two, it'll be in the early 20s.
Yeah. That's that new population, and that's what we advertise. What's the update and the mutations, the 30 new mutations, and this new demographic that the virus's intelligence has adapted to target younger populations. Amazing.
Yes, and that's what Fauci brought forth. And I'm not talking about. There was someone who asked, "Does this include the flu?" No, I'm not talking about the flu today. I'm talking about COVID-19, the novel coronavirus. I'm talking about SARS-CoV-2, whichever way we understand the nomenclature. We're talking about that. That was a 9% of patients ages 1 through 9 tested positive for the virus, as compared to their same cohorts at the end age of life, 80. and older, there was a 2%. We got to get real with the numbers.
Mm-hmm. Okay. So,
And to compare that to the flu is less than 2%. It's 1-point-something% mortality. So we're comparing 5% to 1% in regards to mortality.